welcome to my senior lecture. I felt obligated to do an education lecture, so we will all learn and learn about learning. So this is my outline for today. We're going to talk about the background of on-shift teaching. We're going to talk about some methods of teaching, and then we're going to make our own teaching thingy to do. Okay, so on-shift teaching varies a lot. I'm sure you've been at a shift where you felt like you learned a lot, and I'm sure you've been at a shift where you felt like you learned nothing. The studies show that between like 6 and 25% of attending time is spent teaching. Obviously a wide range. When we break this up, I like to break it, I think it's interesting to break it into this explicit and implicit teaching. So sometimes you learn and you don't really realize you're learning. That's more of the implicit teaching. That's when you're talking about a case with your attending, talking about like the different options. You're not explicitly being taught, you're implicitly being taught. You're still learning from that encounter. And then kind of like a third of teaching is more of that explicit teaching. That's when someone says, I'm going to teach you this, and they sit down and they actually like reference a paper, reference an article. Their main point of their actions is teaching. Why is teaching important? Well, one, it's efficient. So if you work at a place with residents or mid-levels, those attendings can actually see more patients than they could if they're on their own. You know, sometimes we think, am I slowing down the attending, or, you know, am I actually helpful? But you are. Attendings with residents see about like 0.12 more residents, or 0.12 more patients an hour compared to attendings that work alone. And if you're in a place where that's RVUs, that's a place where you're making more money because you're working with mid-levels. The second is obviously growth. We all came from a place where we knew nothing. So it's kind of everyone's responsibility to teach those that are behind us. And then the third is, I think, is self-improvement. If you want to be a good teacher, and if you're teaching a lot, you have to know things. So those are the people who are still like following up on education, learning the new articles so that they can teach people other things. So here are some common teaching methods. First is the Socratic method, which is kind of just confused. It's very similar to pimping, but they say it's like the nicer version of pimping. It's where you're asking questions of your learner, trying to gauge what they know so that you can kind of like pull information out of them and so that you can get them to learn more. A little more formal is like, it's called the 1-minute preceptor. So this involves like a learner presents a case, you ask them to commit to a diagnosis, and then you kind of probe them. You say, why do you think this is your most likely diagnosis? And you kind of ask them more questions about it. And then it gives chance for you to teach something after that. And then for you to both tell the learner like what you think they did well and how you think they can grow. And then there's bedside presentations. We don't do that too much here, but someone from my medical school did. So this is when you're taking the learner and the attending to the bedside and you're giving your case presentation in front of the patient. And that way you can do like on hand, like direct teaching right at the bedside of, oh, is that really what you thought of the abdomen? Let's examine it together. So kind of more teaching at the bedside. But the teaching I wanted to talk about today are teaching scripts. So these are like quick and specific teaching talks for common topics. So this is when a few weeks ago I worked with Dr. Silverberg, and we were thinking about a PE in a patient, and he drew this little diagram of how he thinks of PEs. And he's clearly done that 100 times, and it's just kind of a script he has down, and it's a good 2 to 3 minute presentation you can give someone. So I want to talk more about teaching scripts. So what makes a good one? Personally, I think it's one that tells a story. So you have a beginning, you know, why is this important? What do you want the learner to take away? It has a middle, this is all your content. And then it has an ending, that's you summarizing, taking it back to the patient, putting everything together. Some examples, kind of like sketchy micro. You think they're little stories. Obviously, they can get a little long, but we're thinking of a shorter version of this. They're drawing a picture. They're using things that can trigger your memory. Other kind of things, tables. So creating a table right there with the learner to kind of break things up and having them make the table with you. And then kind of more like pathways, like how you think about something, how you're going to break things down and move on from one step to the next. So we're all going to make a teaching script. Woo! This, this way, when you're the teacher, you're going to be prepared because you're all going to be working with learners. Okay, we can do it. So everyone, I want you to pick a topic. Everyone picks their own topic. These are just some ideas that we have. I want it to be something short. So you want to be able to cover it in 2 to 3 minutes. Something common, you know, what are you obviously going to talk about with your med student in the future? Chest pain, abdominal pain, ACS, and do something you like. Do something that's fun for you. 30 seconds, everyone think of a topic and write it on your paper. Okay. Next, we're going to become experts in our topic. So everyone, like, pull out your phone, pull out your computer, and I want you to spend like 3 minutes reading about your topic. Learn everything there is to know about it. Okay, and then we're going to kind of transition to the next step. Keep reading if you need, but start thinking about your outline. Start thinking about what your beginning is, what your middle is, what your end is, and how you're going to kind of put this together. Okay, and then to start moving on a little bit, think about what your key takeaways are kind of within that. What are you really trying to tell your learner? Okay. Everyone might kind of be at different steps, but start thinking about your visuals. What are you going to draw on your paper? What are you going to like write down? What can you physically do with the person in front of you to get them to like have something that sticks in their mind? Okay, and now I want everyone to kind of practice to themselves, like kind of mumble quietly your like 2-minute speech and your drawing that you're going to do. Okay, and just kind of wrapping it up, I want everyone to kind of critique themselves, critique what they made. Do you think this is important information for someone to know? Do you think it's the right amount of information? Do you think it can keep someone's attention for 2 minutes? Do you think it can give someone a message to go home with that they're going to remember? All right, and then the last step is to share it with the world. You now are an expert on this topic and you're ready to teach it. And the next time that you come across this topic with a junior, with a med student, anyone else, try it. They'll probably appreciate it a lot. So just some takeaway points. Teaching benefits both the teacher and the learner. If you work with smarter, better people, then you have to work less because they help you. And it helps you keep on top of things. There's many different ways to teach, and you can kind of change it to what your resources are and what the patient is. And you are all prepared and ready to teach someone something. So that's it. Short and sweet. Thank you very much.